Hey guys, happy Whiteboard Wednesday. This Wednesday, I wanted to briefly address the different shoulder anatomy as well as common pathologies that we will see. So the shoulder, as most of us know, is a ball and socket joint. The ball being the humerus, pictured here, and then the socket being made up of mostly the scapula, as well as the clavicle has a couple ligamentous attachments in the area. So the shoulder is a very complex joint. It has a lot of muscles attached around it, as well as many ligaments, bursa, that kind of thing, which means there can be a lot of different things that can go wrong, per se. So some of the most common pathology that we see in PT are our rotator cuff disorders. It's pretty common to have things like tendinopathy, impingement, bursitis, and little tears in the tendons, just because of how our shoulder blade and our humerus move when we're lifting our arms up or doing repetitive motions. It's pretty likely for those tendons to get impinged a little bit and have microscopic tearing, which may lead to tendinopathies. Other than rotator cuff disorders, there's also glenohumeral disorders. So the main one being adhesive capsulitis, or as most people know, frozen shoulder. And that's just where we have a buildup of scar tissue around the shoulder joint itself, limiting our motion and causing that freezing type. Along with the adhesive capsulitis, there is arthritis. That's another glenohumeral disorder. And then if we go further, we have acromioclavicular syndrome. So that involves this little bone up here, the acromion, which has some ligamentous attachments to our clavicle or our collarbone. So sometimes if we're playing a sport or we fall on an outstretched arm, we can kind of injure those ligaments and cause a little bit of instability or pain right at that region. So finally, we have glenohumeral instability. So that's going to be our shoulder dislocations, subluxations. So us just getting a little more movement in the shoulder than we necessarily want. Sometimes those can cause traumatic injuries to the nerves, the blood vessels, or even just the muscles around the shoulder. So there are a few different directions that they can go. The shoulder can, so the ball, the socket, or the ball can go anteriorly, it can go posteriorly, or you could have multi-directional instability, meaning it can go in all different motions because it's just a little bit loose around there. So that's just a really brief Whiteboard Wednesday on the different pathologies and the different anatomy of the shoulder. I hope that's helpful. We'll probably dive a little bit further into each one of these specifically in further posts, but yeah, I hope this was helpful and have a good week.